I found out completely at the age of 21.
Like Lynnez Gray-Thompson, most women find out they suffer from polycystic ovarian syndrome in high school or college.
The edge of the ovary, that's what it is. It's a bunch of little bitty follicles like that.
Often, young women aren't planning for a family at that age, so they aren't concerned.
The last thing that was on my mind was having children. It was all about having fun, living my life. So it wasn't a big deal for me. I just figured, okay, take these birth control pills, go on about my business.
The disease affects between 3 and 5% of all young women. So if a woman establishes her periods early on, about 11 or 12 years of age, and then starts to see them become irregular, the weight gain increases, we can see PCOS in girls as young as 14, 15 developing, and by the time they're 17, 18, it's starting to really become a problem.
There's no exact cause and no exact course of treatment, but PCOS is serious, affects fertility, and gets worse with time.
It's a hormonal condition that's characterized by many different symptoms and signs.
Not everyone who has metabolic syndrome has PCOS, but everyone who has PCOS has metabolic syndrome.
That can cause weight gain, hair growth, irregular cycles, fatigue, and insulin resistance. It all points to an underlying hormonal problem. Your body produces too much androgen and not enough estrogen, so your egg follicles never mature.
This is your left ovary right here. You got this that big black thing, that's a big cyst on your ovary.
To learn that you're actually not pregnant or you haven't at all conceived or even ovulated to be able to get pregnant, it's a struggle.
Lynnez is a new wife, and she and her husband want to start a big family as soon as possible. But they've been trying for a year now without any luck.
I think it puts a strain on the marriage sometimes, not a big strain, but the fact that we're both ready to have children and it seemed like it's taken forever or it's just not happening can sometimes be very, very stressful.
There's hope though. In most cases, getting diagnosed with PCOS doesn't mean you won't have children. It just won't be an easy journey. Doctors usually prescribe a diabetes drug called metformin. It forces your body to recognize insulin, but it has another side effect.
Just metformin alone increases fertility risk. It's a known side effect, like way back when.
Lynnez is just beginning treatment. She'll always have cysts forming on her ovaries, but hopefully the therapy will allow her hormones to balance out and start creating viable eggs again.
This is looking at your right ovary. You see all those little follicles there. Well, I call them follicles, but
That's what polycystic ovaries look like.
looks like a little pearl necklace kind of.
Sometimes it's so easy. It may be just a few pills you take at the beginning of the month and you may start ovulating just fine.
For now, that's her goal, but the dream is so much more, and for the first time, it seems possible.
A boy and a girl would be perfect, but we would love to have 3 children. We feel every child deserves a sibling, and every woman deserves children.
In Baton Rouge, Alicia Bakima, NBC 33 News.